Good morning, everybody. We will start in about a minute or so, just waiting for everything to get set on our end. Happy Tuesday morning, everybody, and thank you for tuning in to Prevention Action Alliance's legislative webinar. I am JP Dorval, Manager of Administrative Support Services here at Prevention Action Alliance, and along with me we have our Executive Director, Marcie Seidel. We also have a special guest calling in this morning that we are very excited about. Given that March is Problem Gambling Awareness Month, we thought it would be fitting to bring some expertise in from someone who works in the field of problem gambling. That said, I would like to introduce our guest, Derek Longmeier, who is the Executive Director of the Problem Gambling Network of Ohio. And Derek will give us some insights on problem gambling in the state and things of that nature. So, Derek, you can take it away when you're ready.
Good morning. Thank you. Thanks so much for the opportunity to talk a little bit about Problem Gambling Awareness Month. And I am based in Columbus, so it would be so easy to just pop around the corner to Prevention Action Alliance. However, for Problem Gambling Awareness Month, we've scheduled property tours throughout Ohio. So I'm calling from Toledo this morning because at 11 o'clock we'll be touring Hollywood, Toledo. So awesome. That's just one of the things that we're working on. So thank you so much for having me this morning.
Cool. And a few housekeeping things before you start. Sure. We're going to ask our viewers to submit any questions that may arise during Derek's portion of the presentation over the course of his presentation so that he can answer them when he's done talking, as opposed to waiting until the end of our webinar as a whole. So please submit any questions that you have for Derek regarding problem gambling in the state while he's presenting so that we can ask him those questions when he's done as opposed to waiting to the end of the webinar. So Derek, take it away.
Great, thank you. As JP mentioned, March is Problem Gambling Awareness Month, and the reason why we focused on March really comes down to March Madness. This is a time where there's a lot of excitement related to basketball and also a lot of excitement related to betting. And we know that sports betting in the United States, specifically related to March Madness, will be about $10 billion in wagers. Keeping in mind that we have about 6 states that actually have legalized sports betting, and the majority of the sports betting that's taking place are not in those legalized states. So that means that we have a lot of sports betting that's happening that is between friends, which within Ohio law could be legal, but also some bookies as well. So something to think about. Just as a general piece of awareness, there is currently no funding available federally to support problem gambling prevention or treatment services. So when we look at all of the other behavioral health addictions, there's federal funding to support that. The federal government receives dollars from taxes on gambling winnings, but that doesn't come back to the state. So for April 10th, there's going to be Problem Gambling Advocacy Day, which will be held in DC. And the National Council on Problem Gambling is spearheading that effort, and this is the 2nd annual Problem Gambling Awareness Day, really to bring awareness of the impact of problem gambling, as well as to advocate for some of those much needed funds to help those that are negatively impacted. Here in Ohio, for Problem Gambling Awareness Month, we've got several activities. The first was our state conference that was held February 28th and March 1st. So we had about 175 folks participate in that. We also have, as I mentioned earlier on the call, our property tours. So we learned that in having conversations with our prevention and treatment folks that a lot of individuals that are somewhat new to gambling professionally have never been to a casino or racino and are not aware of the responsible gambling efforts that go on at the property, as well as how the voluntary exclusion program works within each state casino and racino. So with that, we've set up property tours. Property tours are open to anyone within the prevention and treatment field that's interested in learning more about gambling. They can get, we'll be going to all the casinos and the racinos. We checked off Northfield Park and Mahoning Valley last week, and we'll be in Toledo in a little bit. But if there's a casino or racino in your neck of the woods, you can go to pgnohio.org/events to see what the schedule is and to get signed up. With the way things are structured in Ohio, casinos and racinos are regulated differently. So what you might hear at a casino would be different than what you might see at a racino. Also, with Problem Gambling Awareness Month, we've got daily social media posts that we're pushing out. So in addition to our normal Facebook and Twitter posts, we also have posts specific to Problem Gambling Awareness Month, and it's all branded appropriately. This year's theme is Awareness Plus Action. So we know that we really want to raise awareness about the impact of problem gambling, and then as a follow-up to that, work on having individual action from our prevention professionals, as well as action from communities to just make sure that we're making those connections, because we know that the vast majority of folks that are struggling with gambling problems really deal with that by themselves and don't get support for that. So really helping with that action piece of advocacy, certainly, but also helping to get that connection for folks that are in need. And it's always our recommendation that is, if you come into someone that is struggling with a gambling problem, to call the Ohio Problem Gambling Helpline. You can call as an individual. They can call as someone that's struggling with gambling issues. Their family can call. That number is 800-589-9966. It's also available on PG&O's website and at the tagline of every one of my emails. So if you receive my communications, then that 800 number should be there as well. As we're looking at advocacy, since this is a advocacy call, wanted to let you know that currently there's no pending legislation related to sports betting in Ohio. However, Senator Eklund and O'Brien have been working on putting something together. We are anticipating that would be rolling out sometime in the next couple of months. So that's certainly something that we're looking out for, and we'll keep you all aware of as well, because we know that as we continue to expand gambling, anytime we expand something, then that relates to increase in those that are going to be negatively impacted. So certainly want to ensure that consumer protections are available to support those that need them. So with that, I will open it up to any other questions that you might have, or can hold on until later.
Thank you so much, Derek, for that great info. And I am not seeing any questions as of right now. So that probably means that your presentation was really concise and good. So yeah, I'm not seeing anything right now. I don't know if you want to hang around.
Yep, I'm here throughout. So
okay.
Yep,
okay,
if there's
cool,
other things that pop up, just let me know. Thanks.
Awesome. So yeah, so Derek will be here. So if any questions pop up as we continue our presentation, please let us know and submit your question. All right. So Derek, it was interesting that you mentioned Senator Eklund and Senator O'Brien, because that really ties into our next piece, and that is discussing two bills that we would like our viewers to keep an eye on. Obviously, there are many bills that have already been introduced that we're keeping an eye on. However, these are two bills that really stuck out to us that we feel like people really should keep themselves informed on. The first bill is Senate Bill 57, the hemp bill that was introduced by Senators Hill and Huffman. And that bill is a bill that would decriminalize hemp and hemp products and establish hemp cultivation licensing program. This is really just following in the footsteps of what happened at the federal level, given that agricultural bill, and really the agricultural community is in full support of this, which makes it very difficult because hemp is a cash crop. And obviously we are not in favor of this for many reasons, but it's just going to be a difficult fight. And right now we are slotting ourselves in as interested parties in that. And I'm not quite sure if Marcie has any additional thoughts.
Yeah, thanks, JP. Just wanted to let you know that we are watching this bill very, very closely. It falls in line with, as JP said, with the agriculture bill that was just passed in Washington, D.C., and it creates a very unusual dynamic right now as some states, including Ohio, still have it as a scheduled drug or a scheduled plant, and some do not, and the federal government says that it's okay. So the DEA is backing off of it at this point, but there are certainly warnings going out to people that are transporting it across state lines that there still could be some problems. So it's one to watch. It's one that creates a lot of interest for us especially. So we'll be keeping tabs on this and keeping you up to date as to how it's going.
Awesome. Thank you, Marcie, for that. And the second bill is one that I'm going to go into more detail about, and that is Senate Bill 3, the drug sentencing bill, which was introduced by Senator Eklund and Senator O'Brien. And this bill, it was introduced to express the intent of the General Assembly to develop and enact legislation to reform Ohio's drug sentencing laws. However, recently, last week, in fact, a subversion of this bill was introduced. So now it is Senate Bill 3. And as you can see, the bill was introduced on the 12th. The substitute version was accepted on the 6th. The substitute version is not publicly available as of yet. We are hoping that that language will publicly come out this week on the Ohio legislature's site. However, this bill, if you guys recall from last General Assembly, this was a bill that Senator Ophoff and Eklund introduced, and it was supposed to be a better version of Issue 1 in a sense, where they corrected a lot of the issues and concerns that Issue 1 had, regarding fentanyl trafficking and things of that nature. Because really, given the uproar that came up on both sides of Issue 1, the legislature realized, and Ophoff realized in the Senate, that this was an issue that really needed to be addressed. So they decided to address it through the bill. And last General Assembly, it was simply a bill that was supposed to open conversation before the close of the General Assembly. And now that we're in a new General Assembly, now they have some substantive language and some substantive changes that are going to happen. So in a nutshell, this bill will pretty much overhaul the state's trafficking offenses and possession offenses. And it's a very long bill. I just received the LSC summary last night. I'm going to go through it today. So I don't have a full sense of what the bill does and what the bill doesn't do. However, once that language does come out, I highly recommend that you guys go through it. It is a thick bill, with a widespread reach across the criminal justice system, and obviously will impact addiction, how we treat addiction. And one thing that I do want to point out is that Senator Eklund and Senator O'Brien were very adamant on making sure that everyone understands that their goal is to separate individuals who are dealing with an addiction issue and are sick, and separate those from people who are, trafficking drugs, selling drugs for personal gain and, committing that criminal action. So they really want to create that separation. It's very difficult to do that, but that's what they are attempting to do in this bill, which is good for us. That's a good sign that they're really thinking about people who are suffering from an addiction problem, and that they're not planning to just lump everyone into one box, so to speak, which is what our criminal justice system has been doing for the past couple of years. Even if you have an addiction problem, we've been dealing with addiction and mental health by throwing people in prison, which is not how it should be done. So their goal is to separate the two. So just keep an eye out on that. We will be, I'm sure we will release an Our Thoughts piece on our weekly legislative email update as time goes on. But that is definitely something that we are keeping an eye on. And as of right now, similar to Senate Bill 57, we are an interested party in that. So next, I would like to talk about the biennial budget. It's budget season, everyone, and it's a busy time over here, along with at the legislature, in the governor's office. So the governor's budget is scheduled to drop on Friday the 15th. And just as a brief overview, the governor's budget will drop. Every state agency or state department will submit their recommendations on what they would like to see in the budget. The legislature will take that. The budget bill will start in the House. They'll have hearings. Then they'll pass a version of the budget, and then the Senate will receive it. They'll have hearings, and they'll pass a version of the budget. Then, depending on how similar the two budgets are, the budget that passed out the House and the budget that passed out the Senate, they will reconcile the two. And then there you have it. That'll be our budget for the next 2 years, for fiscal years 2020 and 2021. And the interesting thing now is, given the governor's numerous promises over during the campaign, and all his promises, once he received the nomination, not the nomination, but once he won the election, and has met with different departments and different groups throughout the state, we're interested to see who gets what. So that's what we're trying to keep an eye on. And Recovery Ohio, which is the council that Marcie, along with other treatment and addiction professionals throughout the state, are sitting on currently, will have a huge part to play in determining, or at least guiding, the governor into where he should direct, portions of his budget when it comes to addiction, recovery, treatment, things like that. And I don't know if Marcie has anything to add about that, but.
Yes, indeed. Thank you, JP. Yes, indeed, I do have some things that I'd like to talk about. The Recovery Ohio report, it has been worked on for the last probably 4 to 8 weeks, and quite strenuously, where the committee has met at least twice a week for 4 hours at a time to work on this. And I believe it's Thursday. That the governor will be rolling this out in Montgomery County. I don't have a time, or I know it'll be in the afternoon. I don't have a location or an exact time, but he'll be rolling out the report that was put together by Recovery Ohio Advisory Council. The recommendations, there are 8 areas of the recommendations. Within those recommendations, there's more than 70 action steps that the committee would like to see taken place. It's a very comprehensive document in a 30,000-foot overview, I would say. So we are looking at and defining what it is that needs to be done in the state of Ohio to make sure that we've addressed this part of our society as rigidly and comprehensively as possible. The first of the 8 areas that we have recommendations on is parity. We do have a parity law, which in Ohio, which was passed a few years ago, which makes mental health and addiction services comparable to mental health or physical health wellness. So what you go to the doctor to get insurance to pay for whatever you have in your physical health, you should also have that with your mental health and addiction services as well. Unfortunately, that law is not well known, and it's certainly not being used and taken care of in the state of Ohio like it should be. So there's a lot of activity around that at this point to make sure. That's one of those things that can be done right off the bat that can be strengthen Ohio, yet it doesn't really cost any money in the budget itself. It's just enforcing the laws that are on the books at this point. The second area is dealing with stigma and education. We certainly still have a problem with stigma in the state of Ohio, and lots of things are not happening because that stigma slows down the ability to do things as robustly as we'd like. The third is workforce development. We know that we need to increase all areas of the continuum of care in the workforce, and so there's some recommendations that will be given to the governor and to the legislature of how we can do that. Prevention certainly is something that we've worked very hard on to make sure that has its place in this report, and hopefully has its place in the budget. So we have a lot of recommendations on that, the K through 12 being education being one of it, community coalitions being another, and many others. So I encourage you to take a look at that when the budget does come out and the report does come out, to make sure that we can advocate for that in the state of Ohio. Harm reduction was added in. They tried at the onset of the discussion to put harm reduction in with prevention, but there are two, in my book, there are two different entities that need to be addressed differently, because they each have their place, but the one cannot overtake the other, so they need to be identified separately, and the leadership of the Recovery Ohio agreed with that, and so we have that as our fifth area that we're taking a look at. The sixth is the treatment and recovery services supports, and there's some breakdown within that particular one where early intervention was looked at, crisis support has been looked at, treatment, and then recovery support. All of those are, like prevention, extremely important in the continuum of care, and you can't have one without any of them to be successful. The seventh one that they looked at is special populations, and the two that were very specifically looked at was individuals involved in the criminal justice system, which is why Senate Bill 3 is important for us to watch and keep track of, and then the youth population, which we too believe is a very strong one that we have to take a look at as we move forward in this. And then the last piece that is in the Recovery Ohio is the data measurement and system linkage. And so they will be looking at how important it is for us to make our decisions moving forward in all fields of the continuum and in the budget, in the legislature and in the governors, that we have to have this based on data, so that we know that what we're treating and doing and working on is what we really need to do in Ohio. And that goes right back to us and our SPIF process and what we need to do. And so we're trying to get the state of Ohio to a little bit move into that area too, to make sure that their decisions are based on the need and based on the data that's available. So keep an eye on that. That will be rolled out by the end of the week. And when that report comes out, we'll make sure that it's available for all of you to get. Take a look at it, and let's be actively involved in making sure we do the best in this budget process for all people in the state of Ohio through the entire continuum of care. All right. Let's move on to the marijuana very quickly here. Not a lot has been that we're just continuing to update pretty much the updates of the program and how it's rolling out. As you can see on this slide, we have 16 level 1 cultivators, and right now we have 8 that actually have their certificates of operation. The level 2, we have 13 that will be in the state of Ohio, but again, only 8 have their certification of operation. Dispensaries, we have 9 out of the 56, so there's a lot of room for those certificates of operations to come into play and to get out at this point. The patient and caregiver registry to me is a really an interesting study of what's happening here. We have right now more than 22,000 recommendations, and the registered patients, there's only 19,000 of those with those recommendations. We have the patients being part of it with 1,600 of them with veteran status, 637 patients with the indigent status, and 107 patients with the terminal diagnosis, which, as I think I mentioned the last time and will mention again this time, of all those recommendations is a surprising one to me, because from the years that this has been promoted as an important piece of a public policy, it was always stated that the people with terminal illnesses were the ones that we were really doing this for. So it's interesting how it's played out, and it's not quite as playing out quite the way that it was sold to us in the very beginning. We have 5,400 with unique patients who've purchased medical marijuana, and for the life of me, I'll have to find out what unique means. I don't know at this point, but I decided that we would put that in the slide, and I will do that. I received that last night late, and I will figure out what unique really means in the state of Ohio. And then we have 973 caregivers in the state of Ohio who support those who are patients. Okay, moving on, we have physicians. Right now, we only have 413 certificates to recommend, and we're finding a lot of reports that the physicians who have those certificates to recommend, many of them are in clinics that are very specialized for just marijuana. So we kind of all had this concept and this belief that it would be in our regular system of doctors and our primary care and specialists who work on this significant list of diseases and conditions that one can receive this for, but it now tends to be trickling down into very specific and specialized clinics. So we'll continue to watch how that happens. That shouldn't be a surprise to any of us, but yet it was kind of hoped in my world anyway that it would be within still the normal mainstream of our doctors. Testing. Well, processors next. We only have one processor that has their certificate of operation, and that was just happened in the last couple of days. And processors are coming up late, and that makes sense because we still have to get the product grown, and that's just starting to be grown now and processed before it can go to the processors to turn it into the different forms that are available to be used in the state of Ohio. But we have one up now, and that means that every piece of our continuum in the program, the control program, has the level of that it needs. So we have the cultivators, we have the processors, we have the testing, we have the dispensaries, we have the physicians. So all parts of this program are now operational. And then we have, out of the 3 provisional licenses, we have 3 who have their certificates of operation. So the program is moving along at this point. Okay, and that's all I have at this point. JP?
Yep, thank you, Marcie, so much for all that information. And we will hang around for about a minute or so to see if any questions trickle in. Doesn't look like we're getting any questions. So thank you, Marcie, thank you, Derek, and thank you everyone for spending part of your Tuesday morning with us. It was a great conversation, and we'll see you guys next time. Thanks. Bye.